How has Jimmy Carter been on hospice for over a year? In this video, I'll explain how people can stay on hospice for a year or more, and how not all people on hospice die. So hospice criteria. Let me explain how this works. When someone comes on to hospice, they get admitted onto hospice, they get approved for hospice. We as healthcare professionals are technically proving to Medicare that because of whatever disease they're coming on for, they have technically or likely less than 6 months to live. Okay, so that's where we start off. So we sign someone up, we get them approved, they're on service. In 6 months, the hospice workers will re-evaluate that person if they are alive still. And many people are definitely still alive on hospice after 6 months. So there's criteria at the end of that 6 months that we have to look at as nurses and talk to our doctors all working in hospice to basically prove again to Medicare, hey, look, with all of this information, even though it's been 6 months already, we can still prove that they likely still only have another 6 months. Like we are proving to Medicare again that they still are appropriate for hospice by showing that they've had decline, they've lost weight, they're eating less, maybe their symptoms have increased, they're likely still going to die within 6 months. If we can do that after that 6 month period, it's called a recertification, and we can recertify that patient to be on hospice for another 2 months. So no longer 6 months, but 2 months. So then they're on hospice, the same team, everything they've been doing for 2 more months. Then if they are still alive, at the end of that 2 months, we have to do another recertification where the nurse comes again and does a bunch of question and answers and checks things out and measures things and talks to the doctor. And if we can prove again, hey Medicare, look, they're still here. It's been 6 months, now another 2 months. But look, we can prove to you that they still are declining. They still are appropriate for services. They still need our help. They still likely have 6 months or less to live. Then we can recertify them again for another 2 months. So that can happen over and over and over again. And that is how someone can stay on hospice for more than a year. So technically, whatever hospice company Jimmy Carter is on, they are now doing recertifications for him every 2 months, proving to Medicare that he has less than 6 months to live. So that is how Jimmy Carter is staying on hospice. Now, to be honest, I'm a little surprised because he's on hospice for melanoma, and I think even metastatic melanoma, which would usually end someone's life quick-ish, I would say, especially since he is 99, I think. So the fact that he has had this extended period with the disease he has is quite shocking, at least to me as a hospice worker, but it's perfectly legal and happens all the time. So on hospice, there are certain diseases that I would look at as a hospice nurse, and I'd kind of know this person is likely going to be on hospice for possibly some time. And those are usually like chronic terminal illnesses, like a lung disease called COPD, a heart disease called CHF, dementia, Alzheimer's disease, Parkinson's disease. Those are like progressive, life-limiting, usually eventually terminal illnesses. And you can come on to hospice and stay on hospice for an extended period of time before you actually die. Or people actually can come off hospice because, like I said, there's those reevaluation periods. So let's say someone's initially signed up, they're on for 6 months. At the end of 6 months, we can still prove to Medicare they have declined. We recertify them for another 2 months, right? And then at the end of those 2 months, we can't really prove to Medicare anymore. They haven't really declined. They've stayed the same or even gotten a little better. Those are the patients that we do have to transition off of hospice. So people don't always die on hospice. I'm sure many of you watching this video have had that experience. So what happens to the patient and the family then? They kind of can be really upset that this is happening because they need our services. I don't necessarily think it's like the best thing that we do this, but it is something that does happen. So we usually try to transition them back to their primary care physician, get them set up with a caseworker so they can still get the equipment they need just through a different resource, not on hospice. And it can be a stressful time for someone. I will say Medicare does allow the family to make an appeal. So 48 hours after you get the notice that you're going to come off hospice, you can call this Medicare number that your hospice company will provide for you, basically make an appeal saying, hey, they're saying I'm coming off hospice or my loved one's coming off hospice, but we think that's wrong. We still want hospice. You can make this appeal. Medicare will look at everything that we've done as far as like documentation, and they will either side with the hospice company or side with the family. If they side with the family, you can stay on hospice again. And that's good for both parties, I think. So that's one important thing you should know. And usually your hospice company will explain that to you. At the end of the day, I just want people to know that you can live on hospice. You can come on hospice. You can come off hospice, whether it's the hospice company choosing that for you or you choosing that. You deciding you want to come off hospice and then go back on later. There are many options when it comes to hospice, and it's not just all about dying on hospice. Educating yourself and being prepared for your end of life and knowing that this is an option for you is what's important.